Now I'm going to go ahead and share my desktop. Okay, so I'm going to start at Discus, where most of you would start, and we're going to go down to health and medical. So I'm assuming that you work in public libraries or community college or college libraries, and so these are some of the questions that you might receive, some of the sources that you might want to use. So let's start with Consumer Health Complete. This is a great database for consumers, and just as a good starting point, because a lot of times, say your mother was diagnosed with breast cancer and you want to, and a patron comes in to learn more about breast cancer. What are some medications? You know, what can we do about these things? Or a stroke or a heart attack, very common things that unfortunately happen in everyday life that the patrons might want to learn about. So let's start with a heart attack. So we're just going to go here, a simple search, and search on heart attack. This is what how many people would start. Now what I like about this is that right here, these tabs are set up exactly, very easily for people to look at. Because you'll notice we got 6,900 results. That's a lot of results, and too many for people to start just going through. So I actually like to start with fact sheets and pamphlets. I think these can be really helpful for general information that you can print out and give or email to the patron for them to take home with them and be looking at. So things like causes of heart attacks. This is a good one to start with. So let's go to the PDF. Again, this tells us where it's coming from, heart attack prevention. Now they call it an article. It's actually more like a short chapter in a book almost for this. But this is nice because, oh, this one is from an article, but causes of heart attacks. So this is nice. Here are the warning sign. It's got lots of good images, and this is written for the consumer, for the everyday person to understand, because a lot of times the doctors might have said things that they don't understand, and this is a good, clearly written things. Now again, we can email it, we can save it, or we can print it out for the patron. And you'll also notice that the subject is actually myocardial infarction. So depending on what type of level the patron is at, this can be very helpful. So let's go back to our result list for a minute. Again, medications to prevent further heart attacks, or before you get one, taking a small aspirin a day. Lifestyle measurements. If people are told that, hey, you're at risk for a heart attack, you really need to lose weight, you know, here are some lifestyle changes that they might want to consider. So again, this is, to me, a good starting point, this fact sheets and pamphlets. Now let's go to news and magazines. Now, this database, even though it's called a Consumer Health Complete, it also has a lot of things in there that are written for a much higher level from the Texas Heart Institute Journal. So again, it depends on where your patron is at. What level can they understand? So some of these, something like this can be helpful, Scandinavian Journal of Caring Sciences, but other ones are going to be written at a little bit higher of a level. Again, that's why some of these different tabs are good. Encyclopedias to explain them. You can also go to the images and diagrams and the videos and animation, because say you wanted to, say a patron came in and they said, well, my doctor told me I needed a stent. This is a really good place to come for information very similar to what they might find in Medline Plus. Heart attack symptoms, again, these are written and illustrated for the consumer to be able to understand. So again, if they want to see, okay, what was the doctor talking about? What is plaque? What is plaque buildup on and where is, where are the valves that they're talking about? So again, I think these images can be very helpful. And again, the same with the videos and the animations. Very simply broken down short videos that they can understand. So again, this was Consumer Health Complete. Now, one of the things that I really like about this, we can do the same thing, looking at strokes. If someone says, well, my doctor told me I had a mini stroke, a TIA, again, this is a good place to come. These are evidence-based reports, but again, I would first start with the fact sheets and pamphlets. Something like this, written in simple to understand terms. Again, we could look at news and magazines, or we could go to drugs and herbs. What drugs are prescribed for? So let's go back to the home page for a minute. And now we're going to go just to the drug and herb information. Now, if a patron can come into the library and say, hey, my doctor told me I should go on a drug like Prevacid, very common drug, if I can spell it properly. So but they don't know if they want to go on it. Now, the thing that I like is it's giving me the generic name. Even though I put in the name Prevacid, which is one of the commercial names for it, it's bringing me right to the generic drug name. And what I like is that it gives you, okay, here's the abstract. Why is it prescribed? How is it used? What are drugs that you shouldn't take with it? What special precautions should I follow? What side effects can this have? This is really good information to have. And what I like is that it's given, all of this information comes from AHFS. So this is very reliable consumer information. This is why it's good for the patrons to realize you shouldn't just Google things and find all these different crazy things that are said online. This is information you can rely on. And again, here's the same information in Spanish. Very useful. So this is, again, a good starting point. Consumer Health Complete is a great starting point for consumers to be coming. So let's go back to health and medical. And now I'm going to go, you'll see here are some other resources that you have access to. So this was Consumer Health Complete, and what's nice about that is it's a nice, easy interface. So now we're going to go to MasterFILE Premier, which a lot of people don't realize has very good health information in it. Academic Search Complete is the same. Everything you're going to see in this database, you can do the same searches. Just this has things for the consumers as well as the practitioner in here, where Academic Search Complete is a little bit higher level. So I'm going to start in here. This has, we're going to just do a quick search for something like breast cancer. If someone's worried, and you'll see immediately 10,000 results. That's a lot of information. So if we come down here, you'll see it goes back all the way to 1952. It was the first article in here about breast cancer. So when looking for medical information, you should always, nothing more than 10 years old should be looked at for medical information. So now we limited it to just from 2009. So we want much more recent things. And you'll notice the first thing is good housekeeping. Maybe, maybe not, depending on if they want the stories about other breast cancer survivors, something like this might be helpful. Issues in Law and Medicine, The New Yorker, you know, about invasive breast cancer. So you'll notice a really wide variety, things like prevention, American Journal of Health Studies, a very American Journal of Public Health. It's very, very different types. So we could come down here and say, do we want magazines or do we want academic journals? It depends. Again, what I like is looking at the subject headings. Now, if I click on one of these, it will take me only to things where the subject heading is breast cancer. If I click on the Show More, you can see all of the different other subject headings. Say you wanted to find out more about the Susan Komen Foundation. You can click from this screen, you can actually click on multiple subject headings, whereas here, once you click on a subject heading, it will just give you those subject headings. So if I want to know about breast cancer and breast cancer treatment, breast cancer diagnosis, this will help me narrow my search. So now we're down to 889. And again, now we can say, do we want academic journals or magazines? Again, it will depend on who the patron is. So I'm going to go to a magazine like Prevention, very popular magazine for health. And a couple of things that I just want to point out, that again, these are available in all of the EBSCO host research databases. So it's going to be the same in Medline, it's going to be the same in MasterFILE Premier and in Academic Search Premier. So again, you'll see the breast cancer subject headings. These are all the different subject headings. And here you'll notice you can export it to Google Classroom. If any of you work with Google Classroom, you can export it to Google Drive. Now, one thing to note, when you click on the Google Drive, you have to have the pop-up blocker off or it won't export. And also, when you go to Google Drive, it will just export it to your general Google Drive folder. You then have to go into Google Drive to put it in a specific folder if you're going to be sharing folders with other people. You can add it to your folder here. Now, this right here just puts it into a temporary folder. So, and we'll go up to that later. You can print it, email it, save it. You can cite it in all these different ways so that it's already done for you or for the students. You can export it. So if any of you use things like EasyBib, RepWorks, Zotero, or anything like that, it automatically will export to those things. You can also create notes. This is very good, especially if you are going to be putting it into Google Drive or sharing it. You can put the notes right here and they will be sent with, so you're then going to email it, hey, this is a great article, you should read it, and this note will go along with the email. The permalink. The permalink can be very helpful because you should never send this link up here. This is a temporary link that will disappear. The permalink right here is what you want if you want to, again, put it behind Blackboard or Canvas or Moodle, or you want to send it to a friend, you can use the permalink. And the other nice feature is this HTML right here. Again, this is true of all of our EBSCO host research databases. Anything that you have available as an HTML, it's not available when if it's only available as a PDF, but as an HTML, you can listen to the articles. So this is very nice. Say you have ESL learners, or you have patrons who learn in different ways, or visually impaired patrons. Listening to the article can be very helpful. You can also translate all of the articles into the other languages. Now, these are machine translated articles, but they're still very helpful, especially for those who might be ESL learners. This can be very helpful. So are there any questions so far? Okay. So I'll keep going. And again, all of these are available. Now, in something like this, there are benefits like being able to translate or listen to, But if there are images in an article, that's when you want to look at the PDFs, if they have images that you might want to incorporate. But you'll notice all of these things on the right-hand side stay the same. All right, so we'll go on now to the advanced search, and there are a couple more things that I want to show you, again, that are valid in all of the databases. So one of the things I like to show is the publications. If you know of a specific publication that you're looking for, this is an easy way to do a search. So instead of going alphabetical, I'm going to search by subject and description, just health in general. So you'll see things like Journal of American College Health, Healthcare Finance, Men's Health, very popular, Harvard Women's Health Watch. So you'll see there are actually things like consumer reports on health put out by the people who write consumer reports, but it talks about just health-related issues. Bulletin of the World Health Organization. So let's go back here and say we wanted to search in the Harvard Women's Health Watch. We can click directly on that. And if you know of a specific issue that you can look for, or you can just click on this to search right within this publication. We're going to do the same search on breast cancer, but you'll notice all of our results are just from Harvard Women's Health Watch. So again, if you know a specific thing that you're looking for, this can be very helpful. This is also good if you have a patron who came in and said, you know, a few years ago there was an article in Prevention magazine. Can you help me find it? So this is an easy way to do that search. Now you can also set up search alerts this way. We want to email alert to ourselves every time there is a new article in Harvard Women's Health Watch on breast cancer. We can create this alert. So now we have to be logged into our account to actually set it up. If you don't have an account, you create a new account right there. But you can now set up these alerts. So I'm going to add a few more things to my folder. Now I have multiple folders, so that's why it's giving me the choice. And now I'm going to go up to my folder. And these are some of the articles that I've put into my folders before. Now, if you don't sign in, everything that you put into your folder as a temporary folder and will go away as soon as you leave your session. But if you want to save these things for later, you can create a folder, or like I said, you can just upload them to Google Drive if you use Google Drive. So these are just a couple of the things that I just wanted to make you aware of, because most people don't think of MasterFILE Premier as good for health, but both that and Academic Search Complete are very good for health-related things. So now we're going to go back to Discus. We have a lot to cover in the next few minutes in this 30-minute session. So I'm going to go back to Health and Medical. And now I'm going to show you, we have the Health Consumer Edition Health Source or the Nursing Academic Edition. So I wanted to show you to start out with Consumer Health Complete, then go to MasterFILE. Now we're going to go to the more academic things, so that if you've already done some of the basic research and you want to get a little more deep into information, especially I know some people after a loved one is diagnosed with something, they really, really want to understand it and understand what research is being done. So if they're not quite ready for Medline, but they want to get a little bit more academic information, more research information, this is a great place to come. So again, I'm going to do the same thing, going into the advanced search. And you'll notice when we come down, here are some of the field codes down here, so if you know specific things. So I'm going to do a new search on tracheal stenosis. There we go. So let's just do a quick search for tracheal stenosis. And the first thing I'm going to see is where it says limiters. I'm going to take off where it says full text. And you'll notice I got a lot more results, but not everything in here is going to be full text. So depending on what kind of library you work in and how in-depth your patron might want to go, you can decide to take off that full text if you're willing to do some interlibrary loaning for them. So now you're going to have the abstracts from some that you might have to interlibrary loan. So you'll see all of the results right here are in academic journals, which is why I said, you know, starting out with one level and then you get deeper and deeper into it. So everything in here works just like it did in MasterFILE Premier. The same types of information will all be located right here. But now you'll see the subject headings, not that we want this one in particular since it's about rabbits, but you'll notice these are becoming a little bit more medically sound subject headings. So tracheal diseases, stenosis prevention and treatment. So I want tracheal diseases treatment as my subject heading. And now you're going to see we have 7, but those 7 are exactly what I want. So using those subject headings to really focus your search. So now we're just going to spend 1 minute on a very quick thing. And we're going to go down here again to health and medical. And I just want to show you very quickly that you do have access to Medline. Medline is the same as PubMed put out by the National Library of Medicine. We just add some more indexing to it. And again, this is what users are going to use. If a lot of times, this is what physicians, this is what nurses use. But I did want to just make you aware of this because you'll notice so many more field codes are available in Medline. Very things like major subject headings, minor subject headings, much more in depth. Now you can also look at MESH 2017. These are official things like what is the actual term for tracheal stenosis? Use tracheal stenosis. But then we can also explode this term. And you'll notice all of these are then subheadings to be using within tracheal stenosis. So this is just a way to really focus your search. And if you're interested in learning more about Medline or CINAHL, we do have special sessions just on those topics. So back to the advanced search, the other things I wanted to show you that are available in Medline that I wanted to make you aware of is all of these different things you can limit by. So again, if I do tracheal stenosis, and again, I have right now my full text limiters. I'm going to take that off, and you'll see it just expanded it greatly. But I just did want to make you aware of, then again, we could look at all the subject headings. Things like this aren't available in the other databases. So if you want things about tracheal stenosis within infants, if someone comes in and said, my child was, you know, born with this, how do I find reliable information on this? Using something like the MESH subject headings and using limiters like this, you're not going to be able to find those when you're doing regular searches, unless you're using a database like Medline or PubMed. So are there any questions? Okay, so a couple things I just want to show you before we close up, and that is the help page. So if you do have any questions about, say, Consumer Health Complete, we can come here, and this is a good place to look for all of your, you know, frequently asked questions. There are tutorials and how to promote the fact that you have this information available for patrons. So, and all of the different databases that I showed you today each have one of these special pages just for that database. But we also have online training sessions. Again, if you're interested in learning about View upcoming classes, you can see all the different training sessions we have. You know, here's one on Synol. Here's one on dynamic health. And these are given by medical librarians and nurses. So please feel free to join in any of these anytime. Now I'm going to stop recording.